Assalamu alaikum. Welcome to News 69 Breaking News, initiated by Global Media for Peace and Development. Beginning of the now is the headlines. UN warns of rising deportations of Haitian mothers and newborns from Dominican Republic. Children are now freezing to death. Harrowing updates from Gaza. Critical aid blocked in Gaza as fuel shortages threaten life-saving services. Israeli authorities continue to deny UN-led efforts to reach North Gaza with life-saving aid, including the most recent attempt on Friday, according to the UN Office for the Coordination of Humanitarian Affairs, OCHA. UNRWA Senior Emergency Officer Louise Waitridge said that the situation in Gaza is as horrifying as ever for civilians, while conditions continue to worsen. Children are now freezing to death, said Louise Waitridge from the UN Agency for Palestinian Refugees, UNRWA, told UN News. Aid activities suspended in Yemeni Governorate. Gaza humanitarian update. UN welcomes summit on DR Congo crisis. The UN Secretary-General has instructed agencies, funds, and programs to pause all activities in Saida Governorate in Yemen for security reasons, the global body said on Monday. UN welcomes Tanzania summit on Eastern DRC crisis. Now is details. The UN has raised concern over a growing number of vulnerable Haitians, particularly pregnant women, new mothers, and infants, being deported from the Dominican Republic. According to the UN Migration Agency, IOM, recent weeks have seen an increase in the deportation of women, including those who are pregnant or breastfeeding, as well as children and newborn babies. The agency has emphasized the heightened risks these groups face being returned to Haiti, where access to basic services remains severely limited. On Tuesday alone, IOM staff at the Belladère border crossing in Haiti received 416 deportees, including 11 pregnant women and 16 women who are still breastfeeding, meeting the needs. While IOM teams are not present during the deportation process itself, their efforts focus on the needs of deportees upon arrival, many of whom arrive in precarious and highly vulnerable conditions, often without any resources, said UN Spokesperson Stéphane Dujarric, speaking in New York. He explained that IOM provides immediate humanitarian assistance, including food, water, and hygiene kits, as well as first aid, medical referrals, and psychosocial support. Special attention is given to maternal health, and temporary places to live are arranged for women who are breastfeeding when necessary, he added. Worsening conditions. Mr. Dujarric also updated on the situation in Haiti, where rising violence and recent funding cuts are undermining essential services and worsening the humanitarian situation, particularly in the Center Department. Escalating violence on the part of armed groups has triggered mass displacement, with more than 51,000 people, over half of them children, fleeing recent attacks. Many are now stranded at makeshift sites or seeking safety in other regions. No safety inside hospitals. He noted that the University Hospital of Belladère, a major referral facility with about 300 beds, has suspended operations following a wave of insecurity in the area. Armed attacks, a mass prison break, and the destruction of public infrastructure forced the hospital to gradually shut down. Before its closure, it served nearly 850 patients each day, including through maternal care and advanced cancer treatment, he said. Meanwhile, two other hospitals in the area, Street Therese in Hinch and Albert Schweitzer Hospital in Artibonite, are now coming under increased strain and face critical shortages, including oxygen and emergency medical kits. Since the closure of the University Hospital in Belladère, they have treated more than 200 patients for gunshot wounds, strokes, suspected cholera, and malnutrition. Street Therese alone has received more than 3,500 internally displaced people, tripling its outpatient caseload, Mr. Dujarric said. The UN Children's Fund, UNICEF, and humanitarian partners are working to relieve pressure on the health system in Center Department. Mobile clinics are being deployed to reach 30,000 people in host communities and displacement camps, in coordination with the Haitian authorities and the Catholic charity Caritas. Humanitarians are seeking $908 million to support nearly 4 million people in Haiti this year. Only 6% of the funding, $57 million, has been received to date. The horrors in Gaza show no signs of abating, the UN said on Thursday, noting that the Ministry of Health reports that over 46,000 Palestinians have been killed there since October 2023, most of them women and children. Tragically, in the last month alone, 8 newborns have died of hypothermia and 74 children have already died amid the brutal conditions of winter in 2025. And this is the news update for this time. Thank you for watching. Stay with us for next news update.